Before I started chemotherapy and immunotherapy, I spent so much time online trying to prepare for it mentally, but nothing could have prepared me for my personal experience. After 3 cycles of chemotherapy and immunotherapy, I want to share the side effects and how I've handled them. So hopefully it makes the road a little bit brighter for those going into treatment themselves. Number one for me has to be fatigue. After infusion, I go home and all I can do is sleep. They give me 3 anti-nauseant drugs, which cause me to be tired. And so if you're taking anti-nauseants, this is something you need to prepare for. Personally, for me, the fatigue usually lasts around 3 to 4 days, maybe 5. And I can finally find myself being able to be active and sometimes go for a short walk if I'm up to it, or even a run. But the most important thing about fatigue is listening to your body and allowing it to rest when it needs to rest. Number 2 is nausea. And for me, the nausea usually lasts just like the fatigue around 3, 4, 5 days. You just get this whole body feeling in the stomach and bowels that it just doesn't feel right. And so I honestly, my favorite thing to take is ginger. Ginger's helped me so much. And also they send you home with a couple more anti-nauseants to take throughout the week to hopefully stave it off. But honestly, it's something that always comes up. Luckily for me, it's only been a 3, 4, 5 maybe max, and I have never thrown up, thank goodness. But that is a definite possibility with chemo and immunotherapy. 3 on a more physical list would be a lack of appetite or even more appetite. I take dexamethasone, which is a steroid which causes more appetite, and I find myself actually being able to eat a lot more. This helps because chemotherapy can make you lose a lot of weight, so you don't want that to be in the way. So make sure you're eating and eating the types of foods your body can handle, even when it's very hard to. You need to get that nutrition in. Another side effect that I had was mouth sores, and these occur actually during infusion. So when you're hooked up to your chemo infusion, they will give you ice or a popsicle to kind of keep your mouth cold, and that restricts the blood flow to your mouth, hopefully preventing them. My first infusion, I got them pretty bad because I didn't really chew enough ice, and my whole mouth was sore. It really caused me pain while eating, and it wasn't pretty at all. So make sure to get on top of that when you're receiving your chemos. Get that ice in there, make your mouth cold. And if the mouth sores do occur, you need to use some mouthwash. So I, in turn, used baking soda mouthwash. And I did this twice, 3 times a day, and all the mouth sores went away. So in my experience, baking soda works great, and it should for you too. Another well-known side effect is hair loss, and that started with my second infusion, where I would be sitting wherever and I could just pull my hair out easily without any, real force. And I started seeing hair around the house a little bit more, especially when I showered. So I took the plunge and I did it to myself. I shaved my head, and I think it's better to do it sooner than later to get used to it and to go into it feeling confident, because you can't control it, so why worry about it? And it'll grow back. Next is heartburn, and this one surprised me. Honestly, I didn't think that this would happen, but it was just so very persistent after the first and second infusion that I needed to get a prescription. So I talked to my doctor, and they gave me this wonderful drug, so I haven't had the heartburn. So that's definitely something to get on top of before you start. Another one is acne. This is from the steroid. Basically, I was getting acne on my neck, face, forehead, back, and that's just typical with the steroid. But for me, it only lasted about that first infusion. By the second infusion, the acne kind of dissipated and it went away. The next big thing for me was body changes. I've spent the last year, 2 years rather, working out. I was overweight, and I basically said, I need to change. So before treatment ever started, I got my body into a good position to start treatment. I started walking, I started running, and then within a year I ran my first marathon. And after that, I started treatment. So I went in with a really good base. But honestly, with chemo and immuno, I haven't been able to get out as much as I'd like. I haven't been running as much, I haven't been walking as much. It's just what it is. But the good news is that your body could always bounce back. But I have noticed that I'm not looking the same as I was pre-treatment. but that is something to expect. You can't win on all fronts. This is a huge battle that your body's going through, and you need to let yourself rest. You need to take those days off because it's the most important thing you're doing right now. Everything needs to be set aside. But when you can, make sure to get those walks in. Make sure to try to do some physical activity because it will help a lot. Typically, 7 to 14 days after your infusion, your neutrophil count goes to 0. And your neutrophils are your white blood cells that defend your body from infection. Now, the second infusion I had, I went to the ER because I had a fever. My heart rate was raising and my sleep was worse. So I listened to the signs and I went in and I got treated with antibiotics. So it is so important that every day you are using hand sanitizer, you're washing your hands, you're wearing a mask. You basically have to live in a bubble. I go to work 3-4 days a week and I'm around other people and I can't share tools. I can't do anything except protect myself and let the others know that I need protection too. So get others to wear masks, other people not to share, items at work with you. Just live in that little bubble for those 7 days so that you don't get an infection. It's very important. The mental side is a huge part of this. You need a good support system, you need friends, you need family, because all these body changes, everything that you're going to go through is going to hit a little hard. But just know it's temporary and you'll get through it. I'm halfway through mine and I'm managing. The biggest thing was losing my hair, the physical body changes, looking at myself in the mirror, not being happy about what I see. But we know this is temporary. And the great thing about the body is that it can bounce back as long as you put in the effort. And here's to summarize the things that have helped me the most. I listen to my body instead of forcing it. I stay hydrated. I eat when I can, whether it be small meals or large meals when it's more bearable. I take the ginger for the nausea and the other prescriptions my oncology team has prescribed for me. I walk and I run when I feel like it because I came into this treatment already a runner, and I sleep when my body needs it. Some people have a very rough time, but some people have it easier. The most important thing is talking to your oncology team and knowing what to tell them whenever you're feeling off. There's lists of side effects that chemo and immuno can do to your body, and if anything happens to you, you need to communicate that so that this treatment cycle is a lot easier. If you're going through treatment right now, know that you're not alone. There's so many people taking it, and I see them when I go on infusion days, hundreds and hundreds of people. We're all fighting different battles, we all have different lives, but we're in this together, and we will get through it. Thank you for watching, and I hope by sharing my experience, it could help someone else feel less scared going into treatment. Just never give up and keep fighting. We will win.